Okay, rosacea. Um, this is the next one. Um, this is ro- it's a, it's a condition where your face becomes red. Let's say that. Um, Overview. Rosacea um, is a common condition that causes redness and visible blood vessels in your face. It may also produce small red or pus-filled bumps. These signs and symptoms may flare up for weeks to months and then go away in a while. Rosacea can be mistaken for acne, other skin problems, or natural redness. Um, in this picture, you can see the difference between acne and rosacea. Rosacea can affect anyone, but it's most common in middle-aged women who have light skin. Usually, light-skinned people are more exposed to rosacea. Um, there's no cure for rosacea, but treatment can control and reduce the signs and symptoms. Yep. Um, what happens during rosacea? What are the symptoms that are there? Um, First of all, facial redness. Um, as I said, rosacea usually causes a persistent redness in the central part of your face, usually your cheeks. Small blood vessels in your nose and cheeks often swell and become visible. So the main thing that happens is that your blood vessels swell up. They expand a bit, um, and they become visible through your cheeks. Just as when you see it in your arm, next to your wrist, you could see your blood vessels and veins. It's kind of the same thing, but in the skin. Um, Many people with rosacea um, also experience dry, irritated, swollen eyes. Oh, I forgot. I skipped the point. Swollen red bumps. Many people with rosacea also develop bumps in their face that resemble acne. These bumps sometimes contain pus. Your skin may feel hot and tender. Eye problems. Many people with rosacea also experience dry, irritated, swollen eyes and red and swollen eyelids. This is known as ocular rosacea. In some people, the eye symptoms precede the skin symptoms. So it's when the veins in your eyelids they swell up just like in your cheeks, and it causes some eye problems. And I found this also. The next point, which I found a bit funny, honestly, an enlarged nose. Over time, rosacea can thicken the skin of the nose, causing the nose to appear bulbous. This occurs more often in men than in women. These are the symptoms of rosacea. When should a person see a doctor? If you experience persistent redness of your face, basically, if these symptoms pop up and they're not going away, it means there's a problem. It's not like just going in the sun and playing in the sun, and your cheeks start becoming red, and then you say, "I have rosacea." No, it has to be persistent. For you to at least see a doctor and see the condition. Okay, what causes rosacea? Um, the exact cause is unknown. It could be due to a combination of hereditary genes and environmental factors. Rosacea is not caused by pure hygiene. So there's a myth around that. If you have pure hygiene, rosacea will happen. That is not the cause. Um, these things trigger the flare-ups. They trigger your face to be red and all the symptoms. Hot drinks and spicy food make your face go red. Um, Coffee, spices, anything that's hot is going to make face red. alcohol. I don't think we should be worried about that too much. Um, Temperature extremes. If it gets too cold in ice, I think you guys see this when it's too cold or especially too hot. This is where in Saudi, usually the main condition is too hot. Our faces become red, and this is in people with rosacea. Um, these temperatures make their symptoms flare up. Emotions, um, such like for an example, um, an embarrassing moment. Uh, like it's a common thing that in uh, like in an embarrassing moment. Let's say there's a presentation in front of the class and you're nervous. Um, you mess up, your face becomes red. This is one of the things that can flare up rosacea. Exercise, um, your face does become red when you exercise. Drugs that dilate blood vessels, as we know that you will have swollen red vessels in your face when it comes to rosacea. That's why your face becomes red. So drugs that dilate blood vessels, especially ones that deal with blood pressure. And we know the blood pressure drugs are a lot, as we talked about in the first term. These can trigger flare ups. Various cosmetic products, cosmetics as in makeup. Um, we are all men here, so I don't think we need to talk about that a lot. Um, Next slide. So what puts you at risk of developing rosacea? Um, First risk is being a female. Um, Having light skin, particularly if it has been damaged by the sun. So, um, it's swollen red vessels that show up through your skin. So having light skin is not going to be helpful. um, all over age 30, um, as I said in the first presentation, older people tend to have tender skin. Smoke, don't smoke. Have a family history of rosacea. A lot of diseases are hereditary, especially this one. Complications. Over time, the oil glands in your nose sometimes your cheek become enlarged, causing a buildup of tissue on and around your nose, a condition called rhinophrenia. Phema. This complication is much more common in men, develops slower over a period of years. Yeah, your oil glands and your cheeks become enlarged. Diagnosis. There is no specific test to diagnose rosacea. Instead, your doctor relies on the history of your symptoms and examination of your skin. Basically, how persistent is it, and he just checks on severity. You may have tests to rule out other conditions such as psoriasis, eczema, and lupus. Um, Basically, they test to rule out these options, and then they see, oh, okay, you have this is the only option remaining, so you might have it. These conditions can sometimes cause signs and symptoms similar to those of rosacea, so they rule out these options. If your symptoms involve your eyes, your doctor may refer you to an eye specialist for evaluation. Treatment for rosacea focuses on controlling signs and symptoms. Most often, that requires a combination of good skincare and prescribed drugs. In my opinion, good skincare um, is the way to go. Prescribed drugs can also help, but I don't prefer drugs. The duration of your treatment depends on the type and severity of your signs and symptoms. Recurrence is common, so they can go away and come back. New rosacea medication has been developed in recent years. The types of medication your doctor prescribes depends on which signs and symptoms you're expecting. You may need to try different options or a combination of drugs to find treatment that works for you. Prescribed drugs for rosacea include topical drugs that reduce redness. For mild to moderate rosacea, your doctor may prescribe a cream or gel that you apply to affected skin. These reduce the redness by constricting blood vessels. You may see results within 12 hours after use. The effect on the blood vessels is temporary. So the medication needs to be applied regularly to maintain improvement. Your blood vessels are swollen, so they temporarily um, reduce the swollenness. Yes. uh, they need to be applied regularly to maintain improvement. Oral antibiotics. These has to do, especially with the bumps that happen. Um, yeah, you get the bumps, and then your doctor prescribes an oral antibiotic such as okay, I'm not going to pronounce that, for moderate to severe rosacea with bumps and pimples. Um, so basically, the side effect of rosacea, the pimples, and they deal with that especially. Also, oral acne drugs are for that reason as well. If you have severe rosacea that doesn't respond to other therapies, um, your doctor might um, suggest these things. It's powerful acne drugs that also help clear up acne-like lesions of rosacea. Don't use these drugs during pregnancy, as it causes serious spit defects. So I know none of you guys are women, but um, this just shows you how um, severe the rosacea has to be in order to use these drugs, because these drugs are really strong and powerful. Next slide. Therapies. There is laser therapy and other light-based therapies that help reduce the redness and enlarged blood vessels. Uh, they reduce the enlargement using laser or light. Repeat treatment may be needed periodically to maintain the improved appearance of your skin. Your skin. Lifestyle and home remedies that you can try. Um, as we talked in the presentation in the last one, the best way to prevent something is to remove the cause. Um, so first thing is avoid triggers and identify and avoid triggers. Basically anything that causes your flare-ups, such as drinking hot milk or spicy food or alcohol. Um, you need to identify what exactly causes your redness and avoid it. Protect your face. Apply sunscreen and cover your face in extreme conditions, such as snow or extreme sunlight. Um, a hat. Oh, this is the type of hat that I was talking about in the first presentation. The round hat that covers your whole head and neck area. This is good because like the norm. Well, I'll change the slide. Um, the the normal hats don't usually cover your whole head. And there's some areas exposed to sunlight. Apply sunscreen daily. Use a broad spectrum sunlight with blocks both ultraviolet A and B rays. Um, Apply sunscreen after you apply any topical medication you are using for your face. Another thing you can do is treat your skin gently. Don't rub or touch your face too much. Uh, Ironically, I am touching my face right now. Use a non-soaped cleanser and moisturize frequently. Avoid products that contain alcohol or other skin irritants. Reduce visible redness with makeup. Um, Basically, just hide the redness with makeup. Um, this is usually for women. Uh, yeah. Other types of medication that you can try. Um, First one is massage, um, just to relax your skin and reduce swelling and inflammation. Yeah, circular motion, rubbing on the skin can help in reducing inflammation and swelling. Um, Another thing that has been found out that caffeine might reduce the risk of developing rosacea. Even so, bev- even though hot beverages are common triggers. So hot beverages are common triggers. So drink caffeine well, you could drink cold coffee at the end of the day, so it really doesn't matter. Um, and there's other types of therapies that can be used, including emo oil, laurel wood, and oregano oil. Have been touted as possible ways to treat rosacea, but no conclusive evidence supports the idea that these substances are effective. Basically, these are the things that old people know. Um, Usually, like my grandmother uses these types of things. Um, well, I forgot the word that Mr. Natipon used for them. Um, what
For
else?
what?
The types of things that old people use, like old type medications. Um,
Oh, I use one for Hindi
yeah, Hindi,
and like
Hindi.
natural and
Yeah,
Ayurvedic, but there's also homeopathic.
yeah. Those
Yeah.
types of medication. Um, Talk to your doctor if you're considering dietary supplements or other alternative therapies to treat rosacea. Oh no, 3 minutes left. He or she can help weigh the pros and cons. No, we're done. Rosacea can be distressing. You may feel embarrassed or anxious about your appearance and become withdrawn or self-conscious. You may be frustrated. Um, Talking to your doctor or counselor might be good. And that's it. Thank you guys for listening.